Addiction is a very complex disease, and the systems relating to addiction are getting progressively more complex. And it's going to require better training of the health professional and better testing for the risk of the patients. There is a whole body of work going on in new drug testing technology that's discussed and peer-reviewed at the Dominion Advisory Board. The frontline worker in chemical dependency programs very often cannot access or benefit from this knowledge. So we're trying to bring it to the frontline worker. Advisory Board has a diverse number of clinicians, including Dr. Daryl Inaba, who used to be the head of our detox program, wrote a classic book called Uppers, Downers, All-Arounders, and has done a great deal of education and training. One of the leaders on the Dominion Advisory Board is Dr. Ken Blum, who is really the top addiction geneticist in the field. He has identified risk alleles for addiction. Many aspects of the addiction field. First of all, that will be to identify risk relative to treatment. But what I hope will happen, it will also impact on the prescription opiate epidemic. The primary care system and the pain management system will do a better assessment as to the risk of the patient. Many of our training modules that we're evolving are on the clinical applications of genetic testing. One of the key people on the advisory board is Tom Simpatico, who has this project called Mission. Patients come out of the VA, and they might go to medical, and they might go to the neurologist, and they might go to housing, and they might go to the addiction treatment. And they're all over the place, and they get lost. Well, now under integrated care, healthcare reform, and parity, they have to have systems to track. Well, Dr. Simpatico has developed an excellent model called Mission, which he's implementing in Vermont and then presenting it to the rest of the country. It's content training as it relates to specific strategic goals, putting addiction as a mainstream disease and saying you should look at this chronic disease like you do any other chronic disease, like cancer or diabetes. And then it starts this testing and these diagnostic approaches all make sense. So this is a lot of what we talk about in advisory.